Welcome to the Quiz Bowl. First, we are going to go through a couple of the rules just to make sure everybody is on the same page with what's going on. And you all should have received a copy of the rules via email. Hang on. All right. So first, our general rules, no negotiation of final answers will be tolerated. No negotiation of hand raising will be tolerated. We'll talk about hand raising later. No phones, textbooks, or other resources of any kind are permitted. Questions in rounds 1 and 2 will be read a maximum of 2 times. So what that means is I will read the question, someone will answer, and then if need be, I'll have to read the question again. That's the maximum amount of times that I'll be read is 2. Teams may disable or mute their microphones to discuss answers and then may unmute to answer the question in all rounds. Scores will be kept by the moderator and we will give those scores to you in the middle and the end of the rounds. So for answering questions, team to answer the practice question correctly will be the first team to select a category associated with the point value. So they'll be the first team to go first, essentially. To answer a question, the teams will use the hand raised feature. You guys must wait until the question and the answers have been read prior to raising your hand to answer a question. If a team accidentally raises your hand while the question is being read, you'll have ample time to put your hand down prior to the end of the question. So if you accidentally push it, put it down right away. If it was raised premature, but you don't put it down right away, then we will skip this team and move on to the first team who had their hand raised after that to answer in the correct fashion. So teams are required to put their hands down between the reading of questions. If a team answers a question wrong, the question and answers will be reread by the moderator. Other teams will follow the hand raise protocol as stated above. Teams who answer wrong are disqualified from trying to answer with the correct answer if they've already answered the question wrong. Questions will be reread a maximum of 1 time. If a team answers the question wrong, they are deducted the amount of points that question was worth. If no teams answer a question correctly, the next turn falls to the team that selected the previous question. After our rounds 1 and 2, we will move to the final Jeopardy round. So teams will have 1 minute to wager points before the question is presented. And then wagers must be sent to moderator 2 via Zoom on the chat feature. Moderator 2 is Andrew. Following the reading of the questions, the teams will have 1 minute to discuss your answer and send the answer to me, moderator 1, via the chat feature. So you can private message Andrew and I when you have to send us your information. Following the answer submission, Andrew will present the wagers and then I will present the correct answer. Teams will gain their wagered points for answering correctly or lose their wagered points for answering incorrectly. The winner is the team with the most points remaining. Should a tie occur, a tiebreaker question will be asked utilizing a Final Jeopardy round protocol stated above. So we'll basically just go through a Final Jeopardy round again. If any team experiences technical difficulties, including but not limited to loss of internet connection and or visual or audio disruptions, that team will have 5 minutes to resolve their issue, and you will be given a timer for the 5 minutes. If technical difficulties occurred following the reading of a question, that question will be thrown out and no team will have the opportunity to answer. If the technical issues cannot be resolved within those 5 minutes, the quiz bowl will continue with, and that team will end up forfeiting.
Alicia, we're having teams that are having issues finding the that hand raise feature.
Okay. So, hang on a minute.
So
I'm stop sharing my screen for a minute. think it'll be easier. So the hand raise feature is in the reactions button. So it's a little smiley face with the plus on it at the bottom of the screen, of your Zoom screen. If you click that, there's a hand raise. You guys, does anybody not see that? UW La Crosse, you do not see that?
We only have claps and thumbs up.
Okay. Is anybody else having that issue as well, where you don't see the hand raise? Eau Claire as well? Okay. Okay. So what we'll do, if you have the capability of the hand raise feature, use the hand raise feature. If you do not, you can use either the clapping or the thumbs up. It might just be like which subscription your school has or something like that. I'm not sure. But you can still use one of those reactions to answer a question.
So can we quickly do a trial here? Could I have everybody try putting the hands up, or the hand raise feature, try that once and see how it goes? Okay. So theirs is all okay. Okay, I'm still getting something from everyone, so we should be in good shape.
Okay. All right, so I'm gonna go back and share my screen. Do we have any other questions before we start the quiz bowl?
We were wondering how, like, if there's a timer to answer a question, or if you have to answer immediately, and if you delay X amount of time, it goes to the next person, or.
Right, you'll have approximately 10 seconds to answer a question once you raise your hand. Any other questions on the rules? La Crosse.
Yeah, so we can take the thumbs up off. It just goes away by itself after a couple of seconds.
Right.
So
if I guess be really careful not to push it. So that would be my best advice for you. But obviously, you know, it might happen. And so go ahead and see if you can do like a thumbs up instead. You should be able to change your reaction. You can go ahead and try that right now if you'd like, for those of you that don't have a hand raise feature. See if you can change it quick. Did anybody put their hand, like do the hand clap or do the thumb raise? Just to make sure you can change it. Okay. And then can you change it right away, La Crosse?
Yep.
Okay.
Okay.
So if you accidentally like push that on accident, just go ahead and change it when the question's asked. Andrew, does that come through on your end? Okay.
It comes through at my end. What is going to be difficult is also
Watching
pay
it?
attention. Yep.
Yeah. Okay.
So we'll just have to give them, what I would like to do is just give them ample time between questions for it to clear out. I think that'll be easier. So.
Yeah, I think so too, which we had planned on anyways, so it should be okay. Any other questions before we get started? All right, let's go ahead and get started. Let me share my screen here. We can get going. Okay, so our practice question. Which team won the 2019 Quiz Bowl? UW La Crosse, Concordia, Madison, or Marquette?
Okay, so
Andrew, what did you?
Yep, I had Carthage first on that one.
Okay, Carthage, what is your answer?
Concordia, B.
Sorry, that is incorrect. So I'll read the question again. Which team won the 2019 Quiz Bowl? UW La Crosse, Concordia, UW Madison, or Marquette?
Okay, I had Marquette first that time.
All right, Marquette, what's your answer?
Marquette University.
Yes, that is a correct answer, Marquette University. Okay, so do we understand how everything's working? Any questions? Okay. On to the Quiz Bowl. And I will say, you guys, the colors of the point values don't change. So it doesn't show you what you have left. I am keeping track of that. So if there's something that's already been asked, I'll let you know and you're free to pick another one, okay? So Marquette, you have the honors of being the first to choose a category and a point value. What do you choose?
We'll do cranial nerves for 400.
Cranial nerves for 400. Which of the following cranial nerves is not both a sensory and motor cranial nerve? 4, 7, 5, or 10?
Okay. Marquette.
Marquette, what is your answer?
5 or C.
Sorry, that is incorrect. I'll read the question again. Which of the following cranial nerves is not both a sensory and motor cranial nerve? 4, 7, 5, or 10?
Concordia. Was Carthage had their hand up the whole time?
A, 4.
You are correct. Cranial nerve 4. All right, you're up. What question and point do you want?
Let's go general anatomy 400.
General anatomy 400. Which of the following is of the 6 deep hip external? Which of the following? Wow, I'm sorry. Which of the following is of the 6 deep hip internal rotators? The gemellus superior, piriformis, quadratus inferior, or obturator externus?
Carthage.
B, piriformis.
Oh, that answer is incorrect. I'll read the question again. I'll read the question how it's supposed to be typed. So there is a typo. I will read it how it's supposed to be typed. Carthage, you can answer again, just because of that. Which of the following is not one of the deep 6 hip external rotators? Gemellus superior, piriformis, quadratus inferior, or obturator externus?
Carol.
C. Does that go?
The answer is C, quadratus inferior.
Alicia, what was the point value on that question?
400.
Here we go.
All right, yep, you are free to choose your question.
Can we do general anatomy 300?
Yes. General anatomy 300. What is the name of the smallest muscle in the body? The masseter, stapedius, nasalis, or lumbricals?
Carthage.
300.
Carthage, what is your answer?
I'm gonna go with C.
That is incorrect. I will reread the question. What is the name of the smallest muscle in the body? The masseter, stapedius, nasalis, or lumbricals?
Carol.
B.
The answer is B.
Alicia, we got to slow down just a little bit to allow those emojis to clear, I think.
Okay, that's fine. Do you want me to take more time between reading the question a second time?
Yes.
Okay. All right, yep, you can go ahead and choose your category and your points.
Can we just general anatomy 200?
Yes. General anatomy 200. Dorsiflexion occurs in what plane of movement? Coronal, frontal, sagittal, or transverse?
Carol,
Carol?
C?
Sagittal.
Thank you.
The answer is sagittal. All right, you are up.
We'll do general anatomy 100.
What is the longest muscle in the body? Sartorius, vastus lateralis, multifidus, or gastrocnemius?
Concordia,
A, Sartorius.
A, sartorius is the correct answer. So general anatomy is now closed.
Emergency care for 400, please.
All right, emergency care for 400. What position is identified by rigid arm flexion and leg extension after brain trauma? Degenerate posturing, decerebrate posturing, decorticate posturing, or rigor mortis?
Marquette,
And Marquette, what is your answer?
Decorticate.
That is correct.
We'll do emergency care for 300.
All right, emergency care for 300. When alone, what is the appropriate compression to breath ratio when administering CPR on an infant? 30-2, 15-2, 20-2, or 25-2?
Carol,
B?
Sorry, that answer is incorrect. I will reread the question. Andrew, is everyone's emojis cleared?
not quite.
Okay.
There we go. Now we're good.
Right. When alone, what is the appropriate compression to breath ratio when administering CPR on an infant? 30-2, 15-2, 20-2, 25-2?
Can you reread the question, Alicia? I had a little lag here.
Yes, I will reread it.
Thank you.
When alone, what is the appropriate compression to breath ratio when administering CPR on an infant? 30-2, 15-2, 20-2, or 25-2?
Concordia,
And what is your answer?
A, 30-2.
That is correct.
I don't think we're at 900. I don't think we got a point.
Okay, can we please take dermatomes, myotomes for 400?
Yes, dermatomes and myotomes for 400. Which dermatome correlates to the T7 nerve root? Axilla, xiphoid process, and costal margin, umbilicus, or ASIS?
lacrosse,
A,
I'm sorry, that answer is incorrect. I will reread the question. Andrew, let me know when I can do that.
you're okay.
Okay. Which dermatome correlates to the T7 nerve root? Axilla, xiphoid process, and costal margin, umbilicus, or ASIS?
Eau Claire,
B, xiphoid process, costal margin.
That is correct.
again, please let her get through reading the questions.
We have a quick question.
What's that?
Are we supposed to wait until you're done reading the question and the answer to raise our hand, or?
Yes,
Okay, thank you.
yep, question and answers, yep. We are about halfway done with round one. Andrew, did you want to share
Sure.
your screen? Okay.
All right, so this is what it looks like after round one. So Eau Claire with 400, La Crosse at minus 400, Carroll at 600, Carthage at -3, Concordia at 8, and Marquette at even 0.
All right.
Let me get out of here. I gotta stop sharing. All right, do you want to take it back, Alicia?
Yep.
There we go.
Okay. So last correct answer, you are free to choose your category.
Okay, could we do mixed bag for 100?
Yep. Mixed bag for 100. When performing a manual muscle test for the brachioradialis, the wrist should be neutral, pronated, supinated, or 2 of the above.
Carthage.
Neutral, A.
That is correct. All right, Carthage, you're up.
Can we do mixed bag for 200, please?
Yes, mixed bag for 200. A positive Fader test would include sciatica, SI joint pain, anterior groin pain, hip flexor tightness.
Marquette.
C, anterior groin pain.
That is correct. All right. And Marquette, you're up.
Can we do mixed bag for 300?
Yes. Mixed bag for 300. What specific type of facial fracture includes a maxillary and nasal fracture? Lower orbital blowout, Lefort 1, Lefort 2, tripod fracture.
Claire.
B, Lefort 1.
I'm sorry, that is incorrect. I will reread the question. What specific type of facial fracture includes a maxillary and nasal fracture? Lower orbital blowout, Lefort 1, Lefort 2, tripod fracture.
Marquette.
D, tripod fracture.
That is incorrect. The answer is Lefort 2. And correct me if I'm wrong, but I believe Marquette, you had the last correct answer
Yes.
with the mixed bag question.
Yes.
Okay, so because you had the last correct answer, you get to choose the category and point value.
Mixed bag 400.
Mixed bag 400. What age is most common to sustain a patellar sleeve fracture? 6 to 9 years old, 15 to 18 years old, 8 to 12 years old, 20 to 22 years old.
Eau Claire.
C, 8 to 12.
That is correct, 8 to 12. All right, Eau Claire, you're up.
Could we do cranial nerves for 200?
Yes. Cranial nerves for 200. Which of the following cranial nerves is not associated with the eye? 2, 4, 6, or 8?
Oh, Claire.
D8.
That is correct. The answer is 8. All right. And what would you like your category to be?
Can we do emergency care for 300? Is that still open?
Emergency care for 300 is not open. We have 100, 200 in emergency care. We have dermatomes and myotomes, 100, 200, 300. Cranial nerves, 100 and 300. And mixed bag, 300.
Okay, cranial nerves for 300.
Which of the following cranial nerves is not a sensory-only cranial nerve? 1, 2, 8, or 7?
Carthage.
We're gonna go with D7.
That is correct. All right, Carthage, you are up.
Can we have dermatomes and myotomes for 200?
Yes. Dermatomes and myotomes for 200. During an upper quarter screen, checking the strength of thumb extension is correlated to what nerve root? T1, C6, C8, or C7?
Marquette. Oh, Marquette. Yeah.
1,
All right, Marquette, your time is running out.
T1, sorry.
I'm sorry, that is incorrect. I will read the question again. During an upper quarter screen, checking the strength of thumb extension is correlated to what nerve root? T1, C6, C8, or C7?
Carol.
B.
Sorry, that answer is incorrect. The answer is C8. So Carthage, I believe you get to choose a category as you had the last correct answer.
Can we please have emergency care for 200?
Yes. Emergency care for 200. What is a safe carry for a single person to use in a suspected head or neck injury? Clothes drag, fireman carry, pack strap and carry, or cradle carry?
Carthage.
A, clothes drag, sorry.
A, clothes drag, you are correct. We have emergency care 100, dermatomes and myotomes 100 and 300, cranial nerves 100, and mixed bag 300. Carthage, what would you like to choose?
Mixed bag.
Can we please have mixed bag for 300?
Mixed bag for 300. Oh, we must have done this one. I'm sorry.
Yeah. We should only have 3 questions left, Alicia.
Okay. Give me 1 second. Let me double check. I have 4 questions left. I have 4 questions left. I have left emergency care at 100,
Mhm.
dermatomes and myotomes at 100 and 300, and cranial nerves at 100.
Okay. Skip the line, but it's okay.
All right, Carthage, you are up.
Sorry, can we please have derms and myos for 300 then?
Yes, derms and myos for 300. During a lower quarter screen, checking the strength of the great toe extension is correlated to what nerve root? L5, L4, S1, or S2?
Carthage.
L5.
A, L5, sorry.
The correct answer is A, L5. All right, we have emergency care 100, dermatomes and myotomes 100, and cranial nerves 100. What would you like to choose, Carthage?
Emergency care for 100, please.
Emergency care for 100. When working with a bleeding athlete, what is the first thing an athletic trainer should do? Stop the bleeding, elevate the body part, apply pressure, put on gloves.
Marquette.
D, put on gloves.
D, put on gloves. That is the correct answer.
Stud. I don't care.
Then Marquette, you can go ahead and mute your microphone. Marquette, you're up. Dermatomes and myotomes 100 and cranial nerves 100.
Cranial nerves 100.
Cranial nerve 1 is associated with what sense? Sight, smell, hearing, facial sensation.
Marquette.
Smell.
The answer is B, smell. And you're forced to take dermatomes and myotomes for 100. Which of the following cervical nerve root represents the sensory dermatomes of the hand? C5 through 7, C7 through T1, C5, C7, T1, or C8 through C, or C6 through C8, sorry.
Carol.
D.
The answer is D. Okay. So that concludes round 1. Andrew will go ahead and share your points.
My computer's going nuts. There we go. Okay. Okay. Am I sharing? Am I good?
Yep, you're good to go.
So through round 1, we have Eau Claire with 700, Lacrosse with -400, Carroll with 500, Carthage with 600, Concordia with 800, and Marquette at -100.
All right, we will go ahead and proceed with round 2. All right, last correct answer will be selecting the first question for round 2, which I believe was Marquette,
Carroll.
Carol. Okay. Carol, you are up.
Sure. Can we do mixed bag for 300?
Sure, mixed bag for 300. Osteitis pubis is more common in which of the following sports? Volleyball, soccer, tennis, or softball?
Marquette.
Soccer.
Correct answer is soccer. All right, Marquette, choose your category.
Bag 400.
Mixed bag 400. A blank lesion is an injury of the anterior glenoid labrum of the shoulder due to an anterior shoulder subluxation. Bankart, reverse Hill-Sachs, McLaughlin, or slap?
Marquette.
Slap. Slap D.
That is incorrect. I will reread the question. A blank lesion is an injury of the anterior glenoid labrum of the shoulder due to an anterior shoulder subluxation. Bankart, reverse Hill-Sachs, McLaughlin, or slap?
Concordia.
A, Bankart.
That is correct. All right, you are up.
Okay, can we please take rehab for 400?
Yes, rehab for 400. At any given depth of water, the pressure is going to be equally exerted on all surfaces of the immersed subject. This describes what law? Laminar flow law, Pascal's law, specific gravity law, or Laplace's law?
Eau Claire.
B, Pascal's law.
That is correct. All right, Eau Claire, you're up.
Okay, could we do modalities for 200?
Yep, modalities for 200. With regards to therapeutic diathermy, what is the name of the law that states waves must be absorbed to be beneficial? Cosine law, Arndt-Schultz law, Guthrie-Draper law, or inverse square law?
Carthage.
C, Guthrie-Draper.
That is correct.
Alicia, that was 300, correct?
That was 200.
Thank you.
All right, Carthage, you're up.
Modalities for 300, please.
Modalities 300. Which of the following is not an indication for therapeutic electrotherapy? Controlling pain, breaking up scar tissue, minimize disuse atrophy, or facilitate tissue healing?
Lacrosse.
B, break up scar
Break up-
tissue.
B, break up scar tissue? That is correct. Okay, Lacrosse, you're up.
Abdomen 400.
Trunk and abdomen 400. Narrowing of the spinal canal is called spinal stenosis, spondylolisthesis, spondylolysis, or spina bifida?
Marquette.
A, spinal stenosis.
Correct, spinal stenosis. All right, you're up.
Trunk and abdomen for 300.
Trunk and abdomen for 300. Hepatitis would cause pain in which quadrant? Right lower, left upper, right upper, or left lower?
Lacrosse.
Left upper?
That is incorrect. I will reread the question. Hepatitis would cause pain in which quadrant? Right lower, left upper, right upper, left lower.
Concordia.
C, right upper.
That is correct. All right, you are up.
Rehab for 3, please.
What category?
Rehab, please.
Oh, rehab, for 300.
Yes.
The force couple relationship of the glenohumeral joint involves which two muscle groups of the shoulder and or shoulder girdle? Rotator cuff and deltoids, rotator cuff and pectorals, deltoids and trapezius, trapezius and pectorals.
Marquette.
A, rotator cuff and deltoids.
That is correct. All right, choose your category.
Mixed bag 100, is that open?
Mixed bag 100 is open. What does a positive Codman's drop arm test indicate? A labral tear, axillary nerve injury, torn rotator cuff muscle, posterior subluxation.
Marquette.
Torn rotator cuff muscle.
That is correct. All right, you are up.
What is open in rehab?
For rehab, we have 100 and 200.
Can we do 200?
Yes. Rehab 200. With regards to the knee, the most open packed position is 5 to 10 degrees, 50 to 90 degrees, above 90 degrees, or 15 to 25 degrees.
Marquette.
B, 15 to 25 degrees.
That is correct. All right, you're up.
We do rehab for 100.
Rehab for 100. A small amplitude, quick thrust delivered at the end range of motion that is usually accompanied by cavitation. This description matches which grade of joint mobilization? 5, 3, 4, or 2?
Marquette.
5.
The answer is 5. Rehab is closed. Marquette, you can choose your category.
What's open in modalities?
Modalities, we have 100 and 400.
Let's do 400.
All right, modalities 400. Who first proposed the decreased secondary injury theory in 1976? John Wild, Carl Franz Nagelschmidt, Ian Donald, or Ken Knight?
Lacrosse.
D, Ken Knight.
That is correct. All right, you're free to choose your category.
What's open right now?
We have modalities 100, all of Gen Med, For trunk and abdomen, 100 and 200, and mixed bag, 200.
Let's go with Gen Med for 300.
Gen Med for 300. What is the female athlete triad? Eating disorder, alopecia, depression, eating disorder, alopecia, osteoporosis, eating disorder, amenorrhea, depression, eating disorder, amenorrhea, osteoporosis.
Marquette.
D, eating disorder, amenorrhea, and osteoporosis.
That is correct. All right, you can choose your category.
We'll go Gen Med 200.
Gen Med 200. Type 1 diabetes affects how much of the American population? 15 to 20%, 20 to 25%, 5 to 10%, or 0 to 5%?
Eau Claire.
A, 15 to 20%.
That answer is incorrect. I will reread the question. Type 1 diabetes affects how much of the American population? 15 to 20%, 20 to 25%, 5 to 10%, or 0 to 5%?
Lacrosse.
C, 5 to 10%.
That is correct. You are up to choose your category.
Let's do Gen Med for 400.
Gen Med for 400. Herpes simplex virus has blank different types. 80 plus, 60 to 70, 40 to 45, or 50 to 60.
Lacrosse.
80 plus, A.
That is correct. All right, lacrosse, you're up. We have modalities 100, Gen Med 100, trunk and abdomen 100 and 200, and mixed bag 200.
Mixed bag 200, please.
Mixed bag 200. If a patient is able to complete any given range of motion against gravity but with pain, they are given a grade of 3 plus out of 3, 3 minus out of 5, 3 plus out of 5, or 3 minus out of 3.
Carthage.
C, 3 plus out of 5.
That is correct. Carthage, you are up. We have modalities, Gen Med, both for 100, and trunk and abdomen for 100 and 200.
Can we please have trunk and abdomen for 200?
Yes, trunk and abdomen for 200. Pain in the upper right quadrant can be indicative of injury to what organ? Bladder, stomach, spleen, or gallbladder?
Carthage.
Spleen?
I'm sorry, that is incorrect. I will reread the question. Pain in the upper right quadrant can be indicative of injury to what organ? Bladder, stomach, spleen, or gallbladder?
Lacrosse.
Gallbladder, D.
D, gallbladder is the correct answer. Lacrosse, we have modalities, Gen Med, and trunk and abdomen, all for 100.
Modalities, please.
All right, modalities for 100. Which of the following is not a form of therapeutic electrotherapy? Iontophoresis, interferential current, TENS unit, or phonophoresis?
Lacrosse.
A, iontophoresis.
I'm sorry, that is incorrect. I will reread the question. Which of the following is not a form of therapeutic electrotherapy? Iontophoresis, interferential current, TENS unit, or phonophoresis?
Concordia.
D, phonophoresis.
That is correct. All right, we have Gen Med and trunk and abdomen, both for 100.
Trunk and abdomen, please.
Okay, trunk and abdomen for 100. Epigastric pain, right lower quadrant pain, tenderness at McBurney's point, low-grade fever, and nausea are signs and symptoms of which condition? Peptic ulcer disease, appendicitis, irritable bowel disease, or inflammatory bowel disease?
Concordia.
B, appendicitis.
That is correct.
Then we'll just take the last one.
Sure, and that is Gen Med for 100. A medical term used to describe difficulty swallowing is dysphagia, dysphagia, dyspnea, or dysarthria.
Carthage.
A.
Carthage, your time is running out.
We said A, sorry.
Do you have an answer?
Can you not hear us?
No, I didn't hear you.
Oh, we said it like 2 times. A.
All right, the answer is A. Okay. So Andrew will go over where you stand for points because we will be entering our final Jeopardy.
So at this point, we have Eau Claire with a total of 900, Lacrosse with a total of 700, Carol, oh, sorry about that, your points there in the end are moving all over the place. Carol with a flat 0, right? Or you should have 500. I don't know what happened here in the second half. Your points got moved around. Carthage with a game total of 900. Concordia with 1,700. Marquette with 1,200.
Is everybody clear on their point values?
So again, I'll read them again just so you know. Eau Claire, 900. Lacrosse, 700. Carroll, 500. Carthage, 900. Concordia, 1,700. Marquette, 1,200.
Okay, so we will be entering our final Jeopardy round. So teams, use the chat feature to privately send your wager of points to Andrew Meshke. And I will start the 60-second timer in 1 second.
I'm still awaiting wagers from Concordia and Marquette.
Okay. And you can just tell me when you get them in there.
Okay, I've got everybody in.
Everybody's in? Okay. Category is pharmacology. According to the Drug Enforcement Agency, which schedule of drugs has the lowest abuse potential? And then please use the chat feature to send your your answer to me.
Are you able to repeat the question one more time or no? Or have it up or something or no?
Yes. Hang on a minute. The question is, according to the DEA, which schedule of drugs has the lowest abuse potential?
Again, please send your answers to Alicia, or I believe it says WADA, not to me.
Okay. So there was a team that sent me 2 answers. I'm obligated to take their first answer that was sent. Andrew, did you want to read off the points that everybody had wagered?
Yes. So Eau Claire wagered 800. UW La Crosse 700. Carroll 500. Carthage 900. Marquette 850, and Concordia 701.
Okay. UW Eau Claire had submitted category A. Marquette had submitted schedule 5. Carthage submitted schedule 5. Carroll submitted schedule 5. UW La Crosse submitted diuretics. Concordia submitted schedule 5. The answer is schedule 5. So Marquette, Carthage, Carroll, and Concordia all had the correct answer, schedule 5. Andrew, if you need me to read that again, I can do that.
I'll just confirm correct answers were Carroll, Carthage, Concordia, and Marquette.
Yep.
Okay, then I do have game totals here. The winner at 2,401 points is Concordia. Second place was Marquette at 2,050 points.
All right, congratulations, Concordia. So Concordia, you will be representing Wisconsin Athletic Training Programs at the GLADA Quiz Bowl on April 18th. So I will let the GLADA Quiz Bowl committee know that you will be joining them on April 18th. And we would like to congratulate everybody that had joined us for today for our virtual quiz bowl, our first ever and hopefully our last virtual quiz bowl. And again, congrats to Concordia University. It's a great accomplishment. We would also like to thank the rest of our Young Professionals Committee who are not here live with us during the quiz bowl, except for Andrew because he is here. So thank you, Andrew, for being our second moderator and helping keep score. We also would like to thank Megan Bateman, Samantha Tukilski, and Devin Fleming. So a special thank you to the rest of our committee members who helped work on this year's quiz bowl to make it virtual for you. And again, congratulations to University of Concordia. You'll be representing Wisconsin. So
Congrats.
Congratulations.
And thank you everybody for participating.
Yep. Thank you, everybody. Have a good rest of your week.